Hello there. Vaccines for COVID-19 are critical tools for helping bring the pandemic under control. Numerous developed countries have already launched mass vaccination programs, while here on the African continent, we are still on the wait line. On this particular episode of Doing Business in Rwanda, we take a look at the measures that the government has put in place, as well as the strategies in place as it prepares to receive the vaccine and the rollout plans. You will be with me, Naringwa Fiona Muthoni. Rwanda expects to get about 3.7 million COVID-19 vaccine doses from both the COVAX facility and through the African Union's African Vaccine Acquisition Task Team initiative. We took it to the streets of Kigali to see where the people's mind is really at and if they are willing to take the vaccine.
I can take a COVID vaccine because COVID-19 is a dangerous pandemic which will kill men or a huge population in the world.
I would say no. This is because you have not been informed yet of the side effects it has on people. Once I know this, then I can be willing to take it. We do not have enough information on it, and that is why many people are reluctant to take it. It would be best to get experience from people who have already taken it.
Yes, I would accept because the government advises us to. It is also important that we take it since it protects us, although more work is needed to inform the public through the use of different media.
Yes, I'll take it because it protects us from getting infected by the virus and also to protect the people around us. The government has really tried to keep us informed, and we get additional information from the internet. More efforts should be put to reach people who do not have access to the internet.
Honestly, I would accept to take it, but it also depends on the virus and the side effects that the vaccine may have. If it does not have a lot of negative effects, I will take it. But if it does, I will not accept. I would encourage all the young people to do what it takes to keep safe because we are the future.
If it has many negative side effects, I will not take it. If it has more positive effects, then I would be willing to take it. We hear people talk about it, but I'm yet to be well informed.
I will not accept, simply because I don't know the effect of the vaccine. They should carry on more awareness to schools, hospitals, in the street, everywhere to inform people about the virus.
African countries are still waiting on the line to receive the vaccine. The World Health Organization put in place a vaccine introduction readiness assessment tool, and on average, African nations are on 42% ready for their mass vaccination campaigns. The Director General of Centers for Disease Control and Prevention just joined us on what is really holding back the African continent.
Most of our vaccines, okay, and we import most of our drugs. I think one major lesson that we should emerge from this, looking better than we went into this crisis, is the ability to strengthen our own manufacturing capacity for diagnostics, vaccines, and of course therapeutics. If we do that, then we are better prepared next time, and the whole discussion about Africa lagging behind would not be happening again. We have to face it. We live in an era of pandemics. That is the first reason. That is our inability to manufacture on the continent, which we must fix. The second thing is that the global cooperation has suffered a lot in this ability to have timely access to vaccines. And it's very clear we saw that the developed world purchased a lot of vaccines, and at times more vaccines than they needed. So that created a shortage and is still impacting the ability for the less developed countries to have access to vaccines. I think that is just a fact. And we hope that with the efforts that we've put in place, the chairperson of the union, His Excellency Cyril Ramaphosa, put together the AVAC, the African vaccine team to access vaccines. And as you've heard in the media, we have secured about 600 to 700 million doses of vaccines. We are also working closely with the COVAX facility run out of Geneva to get additional doses of vaccines. So we are making progress. I mean, it's not as fast as we would have loved to see, given that we are in a pandemic, but we are not just a standstill. We are making good progress.
Rwanda is set to get the COVID-19 vaccine doses through the African Union's African Vaccine Acquisition Task Team initiative amounting to 2.6 million, in addition to the 1.1 million vaccines expected in the first and second quarter of 2021 from the COVAX facility.
So we expect the vaccine to start as soon as possible. We've already submitted our requests for vaccine to start hopefully next month or even earlier, depending on how we see different approaches and contacts we've made, generally through the African Union, through the COVAX facility. Gavi and WHO have organized a platform which will help countries to get more doses and easier, even if they are in middle and low income situations. So this is our priority currently, and Rwanda intends to vaccinate 60% of its people in phases from priority groups, from healthcare providers, frontliners, moving into other groups like elders, people with comorbidities, with chronic diseases. We'll go look into refugees, with inmates, with other frontliners. And the list will be growing up into including other people, generally who are 16, 18 years and above, because most of these vaccines have targeted this category of groups. So they're the most at risk. So it's an intense 2-year plan to reach this number of people, which is closer to 80%. 60%, which is 8 million almost of the people in Rwanda and residents of this country. So it's an interesting move, and we've been building our warehouse and supply chain and personnel teams at central and decentralized level. We're 100% ready. What we're missing is just the vaccine to arrive in the country. Then the plan is, once we have the vaccine, it will be fast, and we'll be doing it without waiting, without storing vaccines for a long time. So we hope that it will be very, very soon. So our team's vaccine program has been experienced in this rapid rollout. We can do 7 million vaccines in a week time. This is our record in previous vaccines. So it's not going to be a challenge. But as you know, accessing to these vaccines globally is becoming an issue. And we've tried different options to start, at least for those most at risk. We don't limit ourselves to one type of vaccine. Of course, there are vaccines that are advanced than others, like Pfizer vaccine has been secured WHO emergency approval for use, which is ahead of other vaccines. We've already applied for that for emergency doses. We are looking into other vaccines that are easier to roll out and to store in even cheaper than others. But in this situation, we can't limit ourselves to one option, but we also look at what science tells has minimum standards that are required for us to bring this vaccine to our people.
The government has purchased 5 new ultra-cold freezers worth about 50 million Rwandan francs, which will be used to store the COVID-19 vaccines upon their arrival into the country. The Director General of the Rwanda Biomedical Center breaks down for us what is really needed to build capacity.
We have the capacity to store any type of vaccine, including Pfizer vaccine, which requires -70 degrees Celsius. We've acquired additional ultra-cold freezers that can keep actually these vaccines up to 300,000 at a go. And as I said, the vaccines will arrive in the country. The day after, we start rollout. And so we'll have every time space ready to host more shipments. So that's why for us, we're ready for any type of vaccine that is available for COVID-19 for immediate rollout.
Tech health startups have seen a jump in not only investor appetite, but also in the ease of operation. Transportation of the COVID-19 vaccines may cause a logistical challenge, especially for African countries with a poor road infrastructure. Can drones be a solution? Here is Israel Bimpe, Director for Africa at Zipline.
It has been an opportunity since the pandemic started. People realized the need to be able, amid lockdowns and limitation in travel and trying to curb the spread of the disease, I think we realized the importance of using drones to be able to make autonomous delivery and touchless deliveries. And so with the vaccines and the need to be able to deliver all sorts of vaccines, we have been working really hard. And that's why we announced that we've been working with one of the leading manufacturers of COVID-19 vaccines to develop really an end-to-end a cold chain system that even includes storing and the capacity to deliver ultra-low freezing conditions that the vaccines would have to be carried in and be delivered in, which would allow really health facilities to receive small packages of drones that they need when they need them without having to invest in heavy infrastructures, whether that's ultra-low freezers or whether that's ultra-low trucks that would have to be going around countries. And so we'll be starting this coming April in the countries that we are currently operating, which is Rwanda and Ghana. And we also announced that we're expanding to Nigeria in the Kaduna state. So they should be able to also work with us to be able to deliver COVID vaccine. And we are working with different other governments to be able to expand in many other countries across the continent. And of course, our operations are able to do more than 150 flights a day. And that's on a scale basis, you have to understand that's about, it can be, up to 100 doses of vaccine in a package or even more than that. And so we will be able to really deliver a significant amount of COVID vaccine. Of course, it depends on the different cold chain requirements. And it's also something that can be used to adapt the different needs, whether it's our facility that is doing mass vaccination, or whether it's just for the elderly or the health workers. So our technology and our system really allows to be able to respond to whatever the need is for the end users.
Well, that brings us to the end of this particular episode of Doing Business in Rwanda. You're with me, Narengwa Fiona Muthoni. If you have any questions, feel free to write to us on Twitter at CNBC Africa, or you can tag me directly at Fimuthoni. Thank you so much for tuning in.